during this part?
Yeah, thank you so much, Chaplain Sandra. My name is Frankie Herman. I'm a staff attorney with the Urban Justice Center Mental Health Project and a lead coordinator with the Access to Recovery Coalition, which is a project of the Urban Justice Center Mental Health Project. Say that 5 times fast. My pronouns are they and them. And I just want to run us through a few housekeeping things before Chaplain Mitchell leads us today. So just to let everyone know, this is being recorded and might be published. So just kind of keep that in mind. This is meant to be a public space, and contemplate, what you do or do not want to share in a public space, just so everyone can make an informed decision about what to share today. That said, this is meant to be your space. We really encourage you to come as you are, and kind of share your experience or ask questions. The chat function is a great place also to ask some questions. We will be saving all of the chats and sending those to our partners over at OMH so that they can kind of know what kind of questions folks have. So just some technical things. We will be spotlighting the ASL interpreters the whole time. If you want to be in a breakout session that has the ASL interpreter, please just direct message me, Frankie Herman, and let me know so I can be sure to put you in the correct room. I also want to note for interpretive services, or for anyone, there's, at least on my laptop, it might be a little different on if you're using a tablet or a telephone. In order to view the slides and then the speaker, in your upper right-hand side, you can click a little button that says View. And if you click Speaker, you'll see who's speaking and see the slides. If you click Gallery, then you'll see kind of the Brady Bunch, everybody there all at once. So whatever your choice is, that's kind of how you operate that function. You can raise your hand on Zoom to speak. There should be a little button that says Raise Hand that you can find when you kind of look through the different options. And if you're on the phone, the way you can raise your hand to speak is to press *9, and you can mute and unmute yourself by pressing *6. For folks who aren't currently speakers, we're going to ask everybody to mute yourselves so that we don't get kind of a lot of background interference. And we always love to see your face, but if you're on the phone today or if you're not camera capable today, we're happy to have you as yourself in whichever way you are today. So thanks again so much for joining us today, and I will pass to Chaplain Sandra Mitchell. We're very lucky to have her as our facilitator today. She's a super busy social justice and wellness warrior, and welcome, Chaplain Sandra.
Thank you so much. Wow, you're going to make me cry. But I have a turban on so I can use it to wipe my face. Good afternoon, everyone. Thank you so much for your presence, in this endeavor that we're trying to make sure that everyone gets the information and they can really be a part of the bigger conversation, which is access to healthcare. So welcome to our third core community-oriented recovery and empowerment town hall meeting. Woo! And it is being hosted by the Access to Recovery Coalition, also known as A2R, and I'll be telling you more about that. And I am a member, and we want to ask you if you want to join after the town hall meeting. We'll take your information. So next slide. Now, I want to really let you know that this is just a conversation. We're sharing information and it's just a conversation, but we want you to know who's who, right? So the Access to Recovery Coalition, also known as the A2R, it's a coalition of directly impacted people, peers like myself, and providers like myself. So I'm a peer, chaplain, mental health service provider, whatever you want to say. I'm your sister. And the Access Recovery also is working to improve access to medical, mental health supports, and health and recovery plans. Also, it's known as HARP, H-A-R-P. We'll talk more about that. And also the HIV Special Needs Plan, also known as, here we go, we're talking alphabet soup, HIV SNPs. So we just say the HIV Special Needs Plan. Also, the Access to Recovery Coalition is a project of the Urban Justice Center Mental Health Project, also known as, well, I won't get into that. But the person that you heard that just opened us up with the housekeeping, she's our coordinator, and she keeps us really, really focused and to reach out to other people like you here. Now, the next people I'm going to introduce you to, they're really close to my heart because they keep us informed about any changes or what have you, and they give us such great professional development training. It is the New York State Office of Mental Health, big A team, also known as Office of Mental Health. And the Office of Mental Health, the New York State Office of Mental Health, is a state agency dedicated to promoting the mental health of New Yorkers with a particular focus on providing hope and recovery. So they get a big A for me, and I'm sure you feel the same way. Next slide, please. So why are we here? What are we talking about today? I know that's what you were asking. So there's 5 things that we're going to talk about. 1, what is HARP? H-A-R-P, Health and Recovery Plan. What is CORE? OMH is going to talk about that. Number 2, what are core support? OMH is going to talk about that too. How do I get core supports? OMH will come to the rescue and let us know. Grievance and quality issues. Now that's very big for me. I usually can work things out, but then when I can't, I don't know what to do or who to call. Office of Mental Health will help us out with that too. And the last thing, after the town hall meeting, we're going to have breakout rooms, and OMH and the Office of Chemical, I get a blank there, OCA, will be able to help us to put it all together. We'll come back, put it all together, and then if we have any further questions or need any more information or need to be connected, we'll really make sure that you have what you need. So that's what we're going to be talking about today. So sit back and relax, and we're just going to have a conversation. Next slide, please.
Thanks, Sandra. This is Chris. Just to define the alphabet soup here, OCA, Office of Consumer Affairs. Thank you.
Oh, thank you. I had a brain fare.
That's okay. No worries.
Thank you, Chris. Teamwork makes the dream a reality. So now we're going to talk about our format, just so that you can have some structure and know what to expect as we go along. So what we're going to do is we're going to be sharing information for people who are like ourselves, who want services. And also we're going to be talking about the wonderful people that are providers. Now, providers, you're more than welcome, but we want to make space, please make space for the community to ask their questions and share concerns, and then please join in. I'm a provider and I'm a peer, so I got both roles. And so what we're going to do is we're going to present something to you, which might be new. Give us, have a little patience with us with the acronyms, and then we're going to stop and we're going to take time for your questions and your feedback. A couple of questions here and there, and then we'll present something else, and then we'll stop. That's going to be the flow. And then after we have the presentation by OMH and OCA, we will have a breakout. And in the breakout, that's when we can really get into the nitty-gritty and have clarifications and ask questions. So now we move on to community agreements. Just want to make things flowing. So number 1, nothing without us, nothing for us without us. So nothing about us without us. So there we are, we're all here. And we can hear what the changes are and what new things that are happening and how we can gain access. And we are all here. And so that's a great thing. 1 mic and move up. Meaning, if you're kind of quiet, feel comfortable and speaking up. And if you talk a lot, like I do, because I'm a teacher and I explain everything and I want everybody to know, maybe do a little bit more listening. Number 3, speak from your own experience. This is a safe place where you can say, I would like to have better services, or I would like to be able to connect with ABC. So this is a safe place to say I. You're the one that's important here. Number 4, learning and sharing mindset. So the learning and sharing mindset is a safe space. So I'm learning from you, you're learning from us. There's no, we're all experts here in what we are experiencing. So it's a learning and sharing mindset. Mindfulness, number 5. Mindfulness around oppression and power. So I'm not going to say because I've been a peer for more than 20 years, I know everything. No, I know when you speak with me, and then I know. So we won't have any oppression and power here. And OMH is not the big, big king. We're all here together, working together. So I want you to really feel comfortable about that. And this here is a part of a longer journey. We'll have more series, we'll have more talks, we'll listen to you, we'll take what you say into consideration, we'll tweak it, and we'll come back and do some more town hall meetings. And I hope that you'll be there. And lastly, it's okay to change your mind. You might say, I don't like that, or I don't agree with that. And it's okay, but then you know what? After hearing more information, you might say, maybe I'll consider, and then give us some suggestions. So I hope the community agreements are fine with you, that you embrace them, and we can move right on into our presentation. Next slide, please. And yes, everyone will get a copy of the slides sometime in first or second week of February. We're just saying approximately, so please stay tuned and look for our package that we're going to send to everyone who registered with their email. So now we're going to start the presentation, Community-Oriented Recovery and Empowerment, also known as Core Services, and what you need to know. So we have our lovely Katie from OMH. I mean, it's 1:46 and you look like you just came back from Hawaii. So take it away, Katie.
Hi, Chaplain. This is Emily Hetzel, and I'm actually going to take this first part of the presentation, if that's okay.
Oh, wonderful. But you know what? Your name is Emily and didn't know you were coming, but you still look like you came from Hawaii. So take it away. You do. I don't know what you did, but you look wonderful. So go ahead. Go ahead, Emily. Glad to have you.
Thank you. Okay. So my name is Emily Hetzel, and I work for the Office of Mental Health in the Division of Managed Care. I'm part of the team who's been working for the last year or so on the core services implementation. The purpose of our presentation today is to inform people who are interested in community-oriented recovery and empowerment or core services, learn more about what these services are, how the services can be useful, who can access them, and how to access them. I just want to note that the Office of Mental Health, we've been working closely with our partners at the Office of Addiction Services and Supports to incorporate stakeholder feedback throughout the core service program design. We're really excited to share these details with you and want to thank you for the opportunity to speak with you today. Okay, Chris, next slide, please. So throughout this presentation, as mentioned earlier, there will be a lot of acronyms used on our slides. We're going to do our very best to tell you what they all mean and then get into the details. So on this slide, the first thing we want to do is bring your attention to the note in the box at the top of the slide. Behavioral health services is a phrase used to refer to mental health and addiction supports which are paid for by Medicaid. So next, I'm going to review some of the important acronyms below and tell you what they mean. The first acronym is HARP, which stands for Health and Recovery Plan. A HARP is a type of Medicaid plan that provides more behavioral health services than standard Medicaid does. The state uses an algorithm, which is run by a computer, to determine who is eligible to enroll in a HARP. The algorithm takes a look at the historical use of services, including things like hospitalizations and emergency room visits and other kinds of services, and that the level of of intensity and the number of services an individual has received is what informs that algorithm. Right now, there is no other way to enroll in a HARP, like a community referral option. Only individuals identified by that algorithm will be able to enroll in a HARP. Okay, so the second acronym on this slide is an HIV Snip, which stands for an HIV Special Needs Plan. It is another type of Medicaid plan for individuals living with HIV. If someone is enrolled in an HIV Special Needs Plan, they also could meet that algorithm criteria for HARP eligibility that I just talked about a second ago. And if they do, they can access HARP benefits too, like adult behavioral health, home and community-based services, and the services we're talking about today, the community-oriented recovery and empowerment services. So the next acronym, Bhcbs, stands for Behavioral Health, Home and Community-Based Services. These are a type of behavioral health services that are available to HARP and HIV Snip enrollees who are eligible for HIV Snip enrollees who also are eligible for that HARP criteria. And then lastly, we have community-oriented recovery and support services, which is what the rest of this presentation will be about. Core services are a new set of behavioral health services, which are also going to be available through HARPs and for HARP eligible individuals in an HIV SNP. And there's something that's important to know if you've ever received Bhcbs, is that some of those services in Bhcbs are converting to core services. And a couple of slides we'll take a look at a breakdown of which services are converting to core services, so you can see if your services may be impacted by this change. Okay, next slide. So just want to make sure this piece is clear and makes sense to everyone, but a health and recovery plan and HIV special needs plans are a type of Medicaid managed care plan that cover and pay for more behavioral health services than a standard Medicaid plan would. The idea of these services is to get you the support you need to meet your goals. And these services can help increase your overall wellness, improve your life satisfaction, help build or improve relationships in your personal life, things like living independently, going to school, and finding or keeping a job. Next slide. So sometimes it's easier to see things visually. And here we have a visual representation of the previous slide, which shows how the HARP or HIV SNP enrollment in that type of Medicaid plan can lead to more behavioral health services, which are core services in Bhcbs, if you're eligible and interested. HARPs and HIV SNPs have some key benefits that are important to be aware of. In addition to offering core and Bhcbs, these Medicaid plans also include additional behavioral health staff at the plan level. They also provide enhanced care coordination and support a higher quality of life. So most of the rest of today's presentation will focus on core services specifically, as these are new services that are rolling out in just a couple days on February 1st. Core and Bhcbs have different referral and intake pathways. And our goal today is for you to walk away feeling confident that if you're interested in core services, you have some good next steps, to get this important benefit. Next slide. Okay. So in a couple minutes, we'll go into more detail about exactly what core services are and kind of walk you through the details of that. But first, let's talk about how you would know if you're actually eligible and enrolled in the right type of Medicaid managed care plan to get them. First, you need to be at least 21 years old and enrolled in a Medicaid managed care plan. Then you need to be found HARP eligible based on the type and number of mental health or addiction services you've used in the past. Again, this goes back to that algorithm I talked about in a couple slides ago. And your eligibility is determined using that algorithm. Once that algorithm identifies you as HARP eligible, you need to be enrolled in a HARP or Hiv Snip plan. And for a lot of people, this process happens automatically. Once that algorithm identifies you as eligible, you could be passively enrolled from, from one type of Medicaid managed care plan into a HARP. So finally, once you're in the correct type of plan, you would then just need to follow the referral and intake process for core services and Bhhcbs in order to access them. There are different ways to get assistance with Medicaid eligibility and enrollment. You could contact your health plan directly or call New York State Medicaid Choice, and that number is up here right on the slide. If you need assistance in reaching out to your health plan or New York State Medicaid Choice, there are lots of resources available to you, including A2R, which is the group hosting this town hall today, and CHAMP and ICANN, which I know those two resources will be explained in detail later on in this presentation. Next slide. Okay. So here is the breakdown of the which type of services fall under core services and Bhhcbs. So as of today, it's still January. All of these services are still under Bhhcbs, but starting in just a couple of days on February 1st, 4 of the Bhhcbs will transition to core services, and you can see that on the left-hand side. These services are empowerment services, peer support, family support and training, psychosocial rehabilitation, community psychiatric support and treatment. So both of these benefits are available under HARP and Hiv Snip for eligible individuals. You can choose to receive services through core or Bhhcbs or both. You could also choose to access different services from different providers. A good example might be you could get education support services from one agency and peer support from a different, and that would be totally fine. So the rest of today's conversation will focus on core services. Primarily, we're going to focus on what they are and how they could help you meet your goals. Okay, next slide, Chris. So that's the end of this part. Chaplain, do you want to pause for any questions?
Sure, that would be excellent. Thank you, Emily. The more I hear you talk about, the community-oriented recovery services, I'm beginning to understand it more and more. It means that we have more. We have access to more, and that's important. And the power is given back to someone like me who does need more. So do we have, I would just want to thank you for that. It's just really sinking in, so thank you. So is there anyone in the audience that has a question?
We do have a question in the chat.
Thank
Marla,
you.
hi, this is JJ from Urban Justice Center. Marla Burns asked, are you eligible for HARP if you also have Medicare?
Marla, this is a really good question. And the answer is, it kind of depends. If you are enrolled in a HARP and become Medicare eligible, you may be able to stay in your HARP. And if you are enrolled in a HARP, then you are able to access core services. Hopefully that's helpful. Some HARPs also have the ability to allow individuals who are Medicare eligible to remain in their HARP plan, but that's not consistent across the state at this point.
Yeah, that is a good question. And that I'm in that category. And so thank you for bringing that question, JJ. And thank you, Emily, for answering.
I have a question.
Who's I?
I am Chaplain James.
Welcome, Chaplain James. What is your
Oh,
question?
thank you. Okay, my question is, I find that I like to deal with most of my people are people that fall through the cracks. Say someone that has Medicaid, but they can't seem to get qualified for this thing under the algorithms, but they feel that they qualify. What do they do?
Good question.
I have a study question. My question is similar. If this person has a honey worker through public health, and they happen to have been enrolled in straight Medicaid, they're not eligible. What happened to my son, who is now deceased? Huther Doyle sought an exemption from straight Medicaid in order to provide services, which blocked my son from, during the enrollment period, to be on managed care. So I would suggest your clients get on managed care. And if they're not getting on managed care, what's the blocker? I learned this after my son passed away, and I'd be more than happy to share Department of Social Services emails with our county executive that they were graciously willing to send to me. The SPO worker and his case manager or his caseworker were able to finally knock Huther Doyle out or discontinue Huther Doyle services to my son, which enrolled him in managed care. He was set to start HARP services on August 1, and he died on August 7.
And is this, I'm sorry, I didn't get your name.
Yes, my name is Elisa Tobia.
Hi, Elisa.
Hi.
I thought that was your hand. Thank you so much for sharing your heart and still being a warrior and making sure that people, whenever you can, that people will be able to access services.
There's a huge, thank you. Yeah, thank you. You know, there is a huge system check. There honest to God is, there's so many overlaps in funding requirements and licensing requirements. And my son, caseworker through a licensed Office of Mental Health government, government county run facility, he had no knowledge that he even had a honey worker. The honey worker was obligated to, it's just, so there's a huge, I'm not going to get going, but I really hope and pray that this group really does a systemic study of this, and I'll offer my son's case to anyone who's interested, okay?
That is wonderful.
Thank you for dealing with my anxiety. I'll mute myself.
You know what, that's what we do. And as a chaplain, my heart is big and my arms are longer than the rest of my body. So I give you a virtual hug.
These are the kind of problems
Thank you so much.
Chaplain, we have some more questions in the chat.
We have some more questions. So I just wanted to say really, really quick. There is no more straight Medicaid. If we don't choose a HMO, now I'm talking alphabet soup, health management organization. If we don't choose one ourselves, we will automatically be put in one. So there's no more straight Medicaid. And so what we have to do in helping people and helping ourselves is to say, what's out there?
Ma'am, what was the date? Ma'am, what was the date that there's no longer any straight Medicaid? I really need the date.
One moment. Let me just get the thought out there because it's been a long time. Let me just get that out there because then now I'll forget what I was saying. And I just want to get to this next person.
My
I want to say that really quick. No problem. I know we get excited. And so is it Emblem Health? It's going to be the best health management organization for me. Is that going to be US Healthcare? So you get a chance to pick power. Pick what health insurance you want for what it is you need. So that's really great to know. And when the core services kicks in, I think, Emily, what did you say? When it's going to kick in? February? I think you said this.
Yep, February 1st.
February 1st. So we got a little time to look at stuff, whatever like that. And we can always call that 800 number, 1-800-522-4639. 1-800-505-5678. 1-800-505-5678. They're waiting to answer any questions so that you can always make the right decision for you. So let's one more question
Chaplain
and then
Mitchell?
we'll move on.
Hey,
All right, so Kevin-
Sandra, this is Chris. I apologize for jumping in. This is Chris Coyle. I just wanted to get an additional take from Emily and or Katie, just to
Okay.
supplement what we're talking about with Medicaid. Is that okay?
Oh, that's great. Come
Okay.
on in, Emily and Katie.
Thanks.
Thanks, Chris.
And thank you, Chris.
I just want to, I guess in circling back, there may be some individuals who remain in Medicaid, straight Medicaid, which is also called Medicaid fee-for-service. Although the types of, although most people eligible for Medicaid will be required to enroll in a Medicaid managed care plan, like a HARP or an HIV Snip or something called a mainstream plan. But I just want to make sure that people know that straight Medicaid or that Medicaid fee-for-service isn't going away for everybody.
Okay, wonderful.
Thank you. Thank you.
And Katie, are you there? Did you want to share something?
I would also just, I do want to add, because I think it was brought up by a couple of people around, individuals who fall through the cracks, and it absolutely breaks my heart that this is a reality that we live in. As of today, there is no community referral option for HARP. The only way to enroll in HARP or HIV Snip is to be picked up by that algorithm. So that is where we're at today. Unfortunately, it does result in some individuals who aren't able to get into the HARP or aren't able to get into it.
Or die.
One mic, please. Keep, go ahead. Did you finish?
So, I mean, I think that's as much as I can say, is that as of today, there's no community referral option into the HARP. We have a number of mental health services and programs that are available through mainstream managed care and fee-for-service managed care, and for individuals who don't have health insurance at all. So if you are in one of those boats where you are not HARP enrolled and you're interested in mental health services and support, I would really strongly encourage you to reach out to OMH. We can help you find those services in the community. But the next part of this presentation will focus solely on core services, which is a benefit for HARP enrollees.
That is excellent. Thank you. Thank you for that detail. And I just want to make sure, because we're using the alphabet soup language, OMH is being translated as old age. And HARP, H-A-R-P, is being translated as heart, like your heart is beating. So we have to say it out. If we could do that, health and recovery plan. And
Ms.
then,
Mitchell, Ms. Mitchell, I have a question. I'll try and be very, very quick.
Okay, I'm gonna hold it to you. Go ahead.
Some people like myself have met, this is a quick question. I know I can ask Layla, she's out there somewhere. We'll follow up later. It gets complicated with if you have Medicare primary and Medicaid as a secondary. And there are 10 different Medicaid programs. So what I'm understanding now is if you have Medicaid, straight Medicaid is going to go away. You'll have to be enrolled in a managed Medicaid Medicare plan. Is that what I'm understanding?
Katie, Emily?
No, I don't think that is, I don't think that's the scenario. So if you are currently in Medicaid fee-for-service or straight Medicaid, and you also have Medicare is your primary, and you can keep Medicaid, straight Medicaid or Medicaid fee-for-service. You are not going to be required to enroll in a Medicaid managed care plan.
Okay, great.
All right. And so we will have breakout rooms, okay? And we can get a little bit more into the meat of it. And I think we're getting into like semantics. I say straight Medicaid, you say Medicaid, so I think we need to be very keen for that. working in the clinic, we had to really get that straight with the clients, because they would come for their therapy, with their psychiatrist, and then they wanted to go see the nurse and get another service, and they were like, no, you can't have two services, because you can't have two services in one day. And we had to really say what is the difference, and what can they get in one day, and it was just really very difficult. But once we get on the same page to use the same words, then it's not difficult. So there's a will, there's a way. So I want to thank you for this robust questions and feedback and sharing. Thank you. And we are going to move right along. So who's going to take us through? Emily or Katie?
That would be me. No,
All right,
Katie.
Katie, good to see you. And you look like sunshine as well. I don't know. If it's something that you're eating, let me know. I will eat it every day. So take us away.
Thank you. All right, so for the next few slides, I'm going to talk to everyone about the details of what are core services specifically. So if we want to go to the next slide. Thank you. So here's what I want you to know about all core services. This is true of all 4 services that I'm going to take you through individually. Number 1, these services are available in the community. So staff will meet with you in the places where you live, work, learn, socialize, or hang out. This is a mobile, flexible support, and core providers will work with you to figure out where you want to receive that support. So you get to choose, where you're going to be most comfortable. Core services may be provided by telehealth. So if that's something you're interested in, you can talk to your core provider about whether or not they have that as an option. Most do. And if they do, they'll work with you using person-centered practices to determine if telehealth is the right level of support for you. The nice thing is that you can also blend telehealth and in-person services based on your preferences. So you don't have to choose between them. You might do telehealth on one day and in-person services the next. If you feel like maybe COVID-19 numbers are getting really high in your community, you might switch only to telehealth and then switch back to in-person. There's a lot of flexibility for you to choose the level of support that you need. Core services should be really easy to access. You don't need a standardized eligibility assessment. You don't need to join a health home if you're not interested. And you don't need a referral from a care coordinator or recovery coordinator. In fact, this is really exciting. You can self-refer to core services. The amount and kind of services and supports are based on an individualized service plan, or ISP, and that's developed between you and the core provider during the intake process. All right, next slide. So here you see the 4 core services. There are 4 separate types. First, we have empowerment services or peer support. I often just shorten it to peer support. Family support and training, or FST. Psychosocial rehabilitation, or PSR. And community psychiatric support and treatment, or CPST. The next few slides are going to go into a bit more detail about each of these services individually so that you can figure out what you might be interested in and what help you might need in reaching your goals. You could choose to receive just one service, or you could get any combination of services. Next slide. Empowerment services, peer support. So first up is peer support, because we found under Bhcbs, the Behavioral Health Home and Community-Based Services, that this was the most popular service, and we expect that that will continue under core services. Peer support offers help from someone who knows what you are going through because they've been through it themselves. They can share their own story of recovery with you, offering support and helping you navigate the system and your community. So on this slide, you'll see just a few examples of what peer support can do for you. It could help you get engaged in communities of your choice. This could be finding a book club at a local library, joining a gym, finding a community center or faith community, finding a place that brings you meaning, where you can be yourself. Peer support can help you build self-advocacy skills and knowledge so that you can confidently advocate for yourself with your family, your landlords, your doctors, your friends, anywhere where you feel like you need to advocate for yourself, they can help with that. They can help you find and get the supports that you need, whether it's Social Security, recovery centers, warm lines, care coordination, a primary care doctor, or even an online peer support community. A peer specialist can help you access the supports that are the most important to you and that will fit with your lifestyle. Finally, peer support offers a support where and when you need it most, at home, in the community, day, evening, or weekend. I want to give you just a quick example of how peer support could potentially help an individual. Many people have experienced difficulty speaking up in a doctor's appointment. It can be really intimidating to be honest with your doctor and to share questions or concerns, especially if it feels like they're in a rush or they may not be really listening to you. A peer specialist could attend that appointment with you as a support and help give you confidence that you need to ask your questions or make changes to your treatment plan. They could also share their own experiences around self-advocacy with you and getting the medical establishment to take them seriously. A peer specialist might help you think of and rehearse questions in advance. These are just a couple of ways that a peer might help you build your knowledge and self-advocacy skills so that you can feel empowered to make informed choices and take control of your healthcare. Next slide. Family Support and Training, or FST. This is a service that's offered so that your family of choice can be involved in your recovery. Family of choice could involve people who live with you, people who provide support to you. It's really who you define your family as. That could be parents, significant others, children, other relatives, mentors, roommates, close friends. Like I said, it's really whomever you choose to call family. Through family support and training, you and your family of choice can identify goals, strengths, and resources that will support your recovery. The service is all about you and how your family can support you. Your family of choice can receive education on how to better support you, and they'll develop skills to help maintain a positive relationship. I want to give you a quick example of how family support and training might help an individual. Perhaps you have an individual who has a very strained relationship with their parents. They love their parents, but just don't see eye to eye on life choices. Parents of adult children often think that they know what's best, and that can put a lot of stress on the relationship. Through family support and training, they could gain a better understanding of your diagnosis and how it impacts your day-to-day life. The family support and training provider can help your parents find good factual information about mental health or addiction, including information on recovery and empowerment. They might work with the individual and family to improve communication skills and set healthy boundaries so that everyone feels heard and respected. All right, next slide. Psychosocial Rehabilitation, or PSR. This is really a jack of all trades service. And what I mean by that is that it can help you improve your life satisfaction and wellness, whatever that means to you. PSR is another incredibly popular service that is focused on helping you achieve your goals, whether they relate to where you live, where you learn, work, socialize, or hang out. Through psychosocial rehabilitation, you can receive your supports at home, at your job, or in the community. You will develop skills to improve your life satisfaction and wellness. Now, by skills, I mean a variety of things. PSR, or psychosocial rehabilitation, could help you with mindfulness exercises, banking and personal money management, job interview skills, or the job search itself, harm reduction techniques, you name it. You can learn and apply skills to manage your mental health and addiction concerns, and really it's focused on helping you achieve your own recovery goals. You can also learn to manage stress, prevent crisis, and get the quality of life that you want. There are so many examples of how psychosocial rehabilitation can help an individual reach their goals. So for a moment, I just want to think about perhaps one individual who wants to move from a community residence or a group home, or perhaps their family's home, to their own apartment. So in this example, a psychosocial rehabilitation provider is going to work closely with the individual to figure out exactly what skills they need to develop or refine, and what resources they need to access in order to reach that goal of independent living, having their own apartment. The provider can help the individual navigate benefits that may be available, things like housing vouchers, rental assistance, At the same time, they can help that individual build skills like personal budget skills and money management so that they know how much they can afford and they know how to pay those bills once they're in their own place. The PSR, or Psychosocial Rehabilitation Provider, will be there every step of the way to make sure that the individual is making progress towards their goal, and they'll change approaches if something isn't working. All right, next slide. So the last service that I want to talk to you about in detail is Community Psychiatric Support and Treatment, or CPST. CPST is provided by licensed professionals like therapists and doctors to address barriers that impact your everyday life. So think of this like mobile therapy. With CPST, the therapist or clinician comes to you. You can receive therapy and supports for you and your family of choice. Now, when I say your family of choice can be involved, I'm not talking about broad family therapy. What I'm talking about, including your family in the service to support your recovery. So you remain the focus of the service and your family is there as a support to you. Community psychiatric support and treatment can help you identify personal stressors in order to better manage that stress through coping skills. It can also help you prevent experiencing a crisis. Community psychiatric support and treatment offers support for people living with both mental health concerns and substance use disorders, including tobacco use, in achieving recovery and getting the quality of life that they want. Now, I'll share with you one of the most common examples of CPST that I've heard over the years. There are so many individuals who have tried therapy and counseling, and for whatever reason, they just didn't stick with it. There are so many issues that can get in the way: transportation issues, scheduling issues, or just the stigma associated with going into a mental health or addiction clinic. These are just a few reasons why people who want therapy maybe haven't been able to stay consistent. With CPST, the therapist or clinician will come to you. They offer flexible scheduling, so an individual might have their therapist meet with them right in their living room, or they could go for a walk and enjoy the neighborhood or a local park and do some walking therapy with that therapist or clinician. The clinician will work with you to figure out how to minimize those barriers to therapy so that you can get the help that you want and need. Some providers will also offer doctors, psychiatrists, nurses, in addition to therapists, so that an individual who wants medication therapy or assistance with managing chronic health conditions could get that level of support through community psychiatric support and treatment as well. We can move on to the next slide where we have another moment to stop for feedback, sharing, and questions.
Chaplain Mitchell, there's a question in the chat. Kevin asked, what's the difference between an ACT team and CPST?
So that's a great question. Just so that everyone knows what those acronyms are, ACT is Assertive Community Treatment, and CPST, as I was just talking about, is Community Psychiatric Support and Treatment. ACT is a comprehensive, multidisciplinary, team-based approach where you have a doctor, a nurse, therapists, often peer and family specialists, and an employment specialist working together to serve a defined caseload of individuals. It's a very high level of service. It's actually the highest level of outpatient service that we have in New York State. There are a lot of waiting lists for ACT in most communities. The difference with CPST is that this is more like a clinic in your home. It's a lower level of service technically. You won't have the multidisciplinary team, but instead you would have a therapist. And like I mentioned, some agencies will have a doctor or nurse available, but it's more like going to an outpatient clinic where the primary service is regularly scheduled therapy sessions. So it's just a lower level of care, but it's very flexible, and similar to ACT, it does allow for the provision of services in your home or community.
Thank you for that. Are there any more questions in the chat or someone who wants to raise their hand?
There is another question in the chat. Marla asked, where will OMH, or Office of Mental Health, get the staff to offer these services when Central New York has a severe shortage of mental health providers, waiting lists, and clinics with high caseloads?
Yeah, so we are in a bit of a workforce crisis statewide. That is a fact. Many agencies are having trouble hiring enough therapists and other, peer specialists and other staff to provide services. So I just want to clarify that the Office of Mental Health itself does not provide core services. We designate community-based providers, so the hiring will happen at the level of community-based providers. We hope that the rates that we pay allow for attractive salaries to support these services, but I can't promise that there will be no waiting lists. Workforce is an issue at every level of care in the service system. I do know that we have many providers who have been providing adult BHHCBS who don't have waiting lists. So I am hopeful that as we move forward with CORE, we'll be able to maintain a lot of agencies that don't have the same waiting list.
Thank you for that. I just want to do a time check. Frankie, how are we doing with time?
So we are at 2:25 p.m. We are have had a pretty robust question and answer section for this meeting. And I wanted to check in with folks. I was thinking maybe we would skip the breakout sessions in order to allow more time for the Q&A while we have our experts in the room. The breakout sessions don't necessarily have an expert in the room with them. So in other words, we would go till 3 without breakout sessions. Sandra, what do you think?
I think that
That sounds like a great idea.
I think that would be excellent because it keeps the flow. And we do have our experts in the room right now. So let's go for it.
Okay, perfect. So we're going to skip the breakout sessions in favor of having kind of continuing this robust conversation. Thanks for the check there, Chaplain Sandra.
You are welcome. And thank you for you doing so many multitasking things. So are there any more questions before we move on to the next session? Please step up, raise your hand. Does anyone see anything in the chat, a question?
There was a question earlier that Adrian asked. So she wrote, so not every HCBS service is transitioning to CORE. I don't know if you want to just reiterate the answer to that question.
Sure. So that is correct. Not all of the adult behavioral health, home and community-based services are transitioning to CORE. Only the 4 services that I just reviewed. So that's peer support, family support and training, sorry, I'm doing this off the top of my head, community psychiatric support and treatment, and psychosocial rehabilitation. Those 4 services are transitioning to CORE. And so in this next section of the presentation, I'm going to talk about how you can get those services, how you can access them. The other services like habilitation, education support, and the supported employment services are staying in the adult BHHCBS benefit package. So they are still available for HARP enrollees, but the way you get them through the eligibility assessment and a referral from the health home care coordinator, it's different from CORE. So we're going to focus today just on CORE, but there are services that are remaining in the HCBS benefit package.
Okay, excellent. Katie, I have a question for you. I was really listening to the heart of the person who said that, who brought up that there's just such a long waiting list. And, what do they do in the meantime? Can they, are there peer support warm lines? Are there, numbers that they can call where they can speak to someone, to help them?
Sure. There are a lot of different ways, and it's going to be highly individualized based on what that person needs. I'm wondering if someone from the Office of Consumer Affairs wants to talk about things like warm lines and other peer support services that we have available throughout the state.
Yeah, this is Chris Coyle from OCA. I was actually just writing in the chat that OCA is certainly available for ongoing conversations after this town hall for questions that may arise. But yes, we have, in fact, if you want to shoot me an email, I just put my email in chat. We have a whole list of warm lines that are accessible across the state for folks to access if they have questions about CORE, if they have questions about really anything, right, that warrants a call to a warm line. But, for course specific questions, please feel free to reach out to us, for kind of macro level questions. But I can, if you want to shoot me an email, I can also share that warm line list with everybody should they need that. Because I know that, there's a lot of information being shared today, and it's being shared beautifully, clearly, concisely, but it takes a minute to process. So please know that you can reach out to us at OCA for that information and resources moving forward. This is really, as we've said, this is really the beginning of the conversation. This is our third town hall we've done across the state, and we don't want the conversation to end here. This is the dissemination of information, but it's also the beginning of the conversation. So please feel free to reach out. I know Leela's got her email in the chat. I saw John Stenson's email as well. It's a team effort. So please feel free to reach out. Appreciate it.
Thank you. Appreciate all the work that the Office of Consumer Affairs is doing. So are there any more questions before we move on? Anything that's in the chat maybe we might have missed?
There was a question. Oh, sorry, go ahead.
I was going to say we're missing some of the questions in the chat. Steve says, I'm a New York State certified peer specialist. Will CORE help to alleviate the overemphasized importance on billing? Will more funding be available to hire and keep peers? I feel that person-centeredness gets lost. And I kind of lost the rest of it, trying to scroll down.
Yeah, so that's the tension with providing services through Medicaid, right? Is that when you're providing Medicaid services, there's certain documentation requirements and you're billing for time. And that does make it difficult. I think that there's a lot to be said for agency culture, and your employer is perhaps responsible for helping to shelter you from any pressure to like chase billable units. At the same time, if you're working within the Medicaid system, it is important that you capture all of your billable units and make sure that your agency is getting credit and getting paid for the work that you're doing. So within the context of Medicaid, it is important that you are providing billable services, documenting them, and that you can sustain these services. It's a business to some extent, just all mental health services, and you need to make sure that you're getting paid for those. Now, when you mention added funding, there's a lot of initiatives out there right now through New York State. There is infrastructure funding available through managed care organizations. There are several initiatives to support the peer workforce in particular. I'm not sure that today's forum is the best place to get into detail around funding, because I would like to speak more to the HARP members who are on the phone today. And if providers have questions or concerns around that, I would really encourage them to reach out to us or attend our provider forums where we talk about this with them monthly.
Wonderful.
There's also another question. I'm sorry, Chaplain Sandra.
That's okay. Go ahead.
But it says, Elisa earlier on said, asked, where do consumers learn about core services and what is available? How do you self-refer?
So where do people learn about these services? Well, number one, we're doing these forums this month. This is our third one where we hope to be talking directly to HARP members. We have a number of what we call consumer education materials on our website. These are like pamphlets or palm cards. And we actually just got them translated into, I believe, 8 languages. So right now, I think only English is on our website, but the other languages should be going up today or Monday. So that's really exciting. We are doing a lot of education with our provider community, and not just with core services providers, but working with other licensed and funded program types to make sure that they understand what core services are and can connect people effectively. We trained over 1,000 care managers just this last Monday to make sure that they can effectively connect health home members to these services. So there's a lot of work being done on different levels to both outreach HARP members directly and also to work with the mental health and addictions providers that serve this population to make sure that they understand what's happening. In the next portion of this presentation, I'm actually going to talk about how do you get to core services, including how you would make a self-referral.
That is excellent. And I think this is a
Could I
great
just-
transition.
Yeah, could I make an electronic suggestion to you? I think all this paper stuff is wonderful. Why can't we have individuals enroll voluntarily in electronic email notifications of this stuff? I don't know that we have a ton of people in the HARP program on these kinds of conference, workshops. I just want to keep social media and email communications so that when something really new and exciting like this comes out, a person like my 30-year-old son might go, hey, wow, otherwise I think they miss it. Just a thought.
Yeah, so I think the Office of Consumer Affairs works closely with our social media team to promote different initiatives. I know that our Facebook is pretty active. So I guess I would check in with OCA to see if you have anything you want to share on that.
Yeah. I'm not talking about Facebook. I'm talking about direct email messaging, but that's for another time.
Yeah, this is Chris from OCA. That's a great point, because I know that that's certainly the medium of preference, right, for a lot of people to get and receive and disseminate information. So we'll definitely look into that. I just want to pivot real quick, if you'll allow me, because we do have a lot of information to continue to get through, and I think maybe some of the questions you may have probably will be answered as we move through this. So if we can just continue moving, that would be great.
Yes, thank you for helping to push my boat, Chris, because that's where I was going.
I figured it's all good.
Sometimes I'm a little too soft, but then when I put the hammer down, I'm like, what's wrong with her? I'm like, no, we really got to go. So thank you, Chris. I want to transition. Yes, a lot of the questions that many of us have is really going to be answered with these next about 10 to 15 slides. So who do we have taking us through this? We're on slide 22.
Still me.
All right.
Still me.
Okay, so please take it away.
Okay. Thank you so much, Sandra. So now that we've talked about what core services are and who can receive them, I want to briefly look at how you can actually get them. So with the next slide, I want to talk a little bit about the no wrong door referral pathway. This is my biggest takeaway from today's whole presentation that I want everyone to understand, is that there is no wrong way to get to core services. There are multiple referral pathways. We have opened up the front door as wide as we possibly can. If you have received adult behavioral health home and community-based services, or HCBS, then you know that those referrals went through a care coordinator or a recovery coordinator. And there were a lot of hoops to jump through for individuals. There were multiple different parts of the referral process. We have made this referral process to core as simple as possible. So some of the people who might refer you to core, we do still have care coordinators right up front and center. And for many HARP members and Hiv Snip members, their care coordinator is an important part of their service package who coordinates all of the other pieces. Not everyone has a care coordinator though. So who else could get you to core? We've got hospital inpatient units. If you've been hospitalized for a medical reason, a mental health reason, an addiction reason, the hospital discharge coordinator or social worker could connect you directly to core services. Your therapist or doctor, and that could be a psychiatrist or a primary care doctor or any other type of doctor. Your health insurance plan, if they're noticing that maybe you could use more support, they can make a referral. Family and friends, this is going to be huge because so often family members are researching supports for their loved ones, and family and friends can make a direct referral. Most importantly, we have self-referrals. And so any HARP member or HARP eligible Hiv Snip member can self-refer to any core provider. And then we have peer navigators throughout the community. And these exist in different capacities. at different organizations, but peers are another excellent resource to help you connect with core services. Now, you may be wondering if one of these referral pathways is better than another, like if there's a way to get an intake faster. The answer should be no, that these are all equally as important, and core providers are going to schedule that intake just as quickly as they can, no matter where it's coming from. So if it comes through a care coordinator or if it's a self-referral, either way, the core provider will be there to help you. All right, next slide. So as I mentioned, there's more than one way to access core services. We hope that anyone who's eligible for core and who wants core is able to access it easily and without jumping through hoops. I have a few ideas to get you started if you are someone who's interested in core services. First, you can go ahead and just reach out to the core provider directly. You can make that self-referral and get the process started as soon as possible. So that should be good news for everyone here. If you make a self-referral, I do want you to be aware that you should ask the provider if they accept your health insurance. So not every provider accepts every health plan. So it would be important to say, hi, you know, I think I'm interested in core services and my health insurance is Fidelis. Do you take Fidelis? Or my insurance is United Healthcare, you know, whichever MCO or managed care organization you have, you would ask if they accept it. From there, you should be able to schedule an intake, and it should be as simple as that. Now, if you're wondering where you find a core provider, we do have a list on our website. It's called a designation list, which means that the state has designated them as a provider of core services. We're also working on updating our mental health provider directory on the OMH website to include all of the core services providers. So on our website, you can get those lists, and we can give a link to this group. I believe that Frankie and the A2R team has a number of resources that they're going to share with attendees. If you don't want to reach out to a core plan directly, or core provider directly, that's okay. You could contact your health insurance plan to be connected with a local in-network provider, so they could help facilitate that referral for you or give you a list of places that you could call. So they're available to help you with that. And lastly, if you have a care coordinator, that's a really good person for you to talk to about what your options are, and they can help facilitate that referral and get the paperwork done for you. Now, just like any other benefit covered by your insurance, the core provider does need to document medical necessity. In this case, it means getting a recommendation from a qualified provider known as a licensed practitioner of the healing arts, or LPHA. The core provider is responsible for getting this form completed during the intake process. So if you're interested in seeing what the form looks like, it is available on our website, and we've put the link right here in the PowerPoint for you. But what I want you to know is that you don't need to worry about getting the paperwork done. That is the core provider's job. They will work with you during the intake process to make sure that that recommendation is filled out and signed. If you're wondering who is a qualified LPHA or licensed practitioner of the healing arts, I'm going to give you some examples on the next slide, which we can go to now. So who are LPHAs? This slide is just some examples. It's actually a pretty long list. As you can see here, psychiatrists, licensed clinical social workers, nurse practitioners, physicians or doctors, and physician's assistants, and licensed mental health counselors are just some examples. A simple rule of thumb is that most licensed therapists or clinicians, doctors, and nurses are LPHAs. If you're looking for that complete list, you can always check out the recommendation form itself, which is linked on the previous slide. All right, next slide. So there's a lot of acronyms on this slide, but the point is, what if you're already receiving adult behavioral health, home and community-based services, community psychiatric support and treatment, psychosocial rehabilitation, family support and training, or peer support? So what if you're already getting the services that are transitioning to core? What happens? The good news is that your services will continue as is. Your current services provider will be transitioning over to core on February 1st, and they will work with you to update your individual service plan or ISP for core services. So there should be no change in your services or benefits. And with that, we can go to the next slide where I think we have another point to stop and take feedback, questions, or sharing. So back over to you.
Yes, thank you so much for explaining all that and helping us through the alphabet soup. I get stuck on acronyms. Even if I use them myself, I forget, but you really helped us with that. So thank you. Do we have any
Yes,
questions?
we do. We do. Valerie asked, as a recipient of services, where could I go online to do my own research about if CORE is right for my needs?
Great
So
question.
I would start with our website where we do have some consumer education materials. They're pretty brief and to the point, just telling you kind of what the services are and what types of goals they can help with. I would also really encourage you to pick up the phone and call a CORE provider and just have a conversation around like, hey, you know, these are some of the things I'd like to work on. You know, do you think you could help me? And they'll be able to talk you through it. So I would start with our website and then, you know, move on and have a conversation with someone.
The next question in the chat is, what is the difference between CORE and Bilt? It's BILT program, other than Bilt consumers aren't identified as behavioral health. And I'm not sure what Bilt stands for, but maybe you know, Katie.
I have never heard of Bilt.
Yeah, the Bilt program, I was the questioner. So the Bilt program runs through the Department of Social Services. And basically, they did a lot of those things with my son, Matthew, with the exception of anything directing or supporting him in the mental health component of it. They did do substance abuse referral, but again, it's running under a different department with a lot of the same skill sets and protocols. So I just don't think they identified as much, but it might be worthy to look at that and see where they rub edge to edge and overlap. So all these people do get services.
Yeah, thank you for that. That's something I will look into.
Chaplain Mitchell, you have another question in the chat from Heather. She asked, is there a code or a way to identify if the person has been targeted for CORE on EPACES, EPACES? For example, with HCVS services, there are codes H1 and H9.
Yeah, so this is, I would say, probably more of a question that providers would ask than for HARP members, which is our focus today. So I don't want to get too into the details, but yes, in EPACES, H1 and H4 are the H codes that would indicate that an individual is HARP enrolled or Hiv Snip enrolled and HARP eligible. It doesn't mean that they've been outreached for CORE. It just means that they may, that it's a part of their benefit package and they could receive CORE if it's recommended by a licensed practitioner of the healing arts.
Are there any more questions?
No more questions in the chat.
Okay, I have a question. I am in a HARP, a health and recovery plan. I have a care coordinator. Would I be able to call my care coordinator and say to him, I would like to start going to a clubhouse. In this clubhouse, I can use computers and brush up on my skills. Would I be able to ask him to help me do something like that?
Yeah, so clubhouses are not a CORE service. They're actually funded through grants and direct state aid. So the nice thing is that clubhouses are available to any New Yorker with a mental illness if you have one in your community. There are a number down in New York City. There are fewer in the rest of the state. A care coordinator would be a perfect person to talk to about accessing clubhouse services.
Okay. And now I was really happy to hear that 1,000 people have been, service providers have been trained just on Monday. My God. I want to send you all to Hawaii. My care coordinator sometimes does not get the training, and he's so dedicated. What if my care coordinator did not get the core services training? What could he do? Who could he reach out to?
Well, so the awesome news is that we recorded that training as well as an earlier training that we did in December that's a little bit shorter, and they are both archived on the MICTAC webpage. We can get a link to that website out to everyone. So we would encourage people to review the recorded webinar and then to connect with us with follow-up questions.
That is
Sandra,
wonderful. Thank
he
you so
has
much.
you. Educate them.
Do we have anyone else who may have a question? We have to move on. So let's continue to move on and put some motivation, put some momentum. How about that? We'll just listen. We're gonna get to the real meat of things. Things are not going right. I have a grievance. What do I do? Is this slide 28? Yeah, we're going to bring to you Frankie, our Frankie, who's going to be able to touch. He's our staff attorney with the Urban Justice Center, with the Mental Health Project, and she is our leader. I'm sorry, they are our leader and in the Access to Recovery Coalition. He helps us to keep everything organized, everyone connected. And I just want to say thank you, Frankie. You are the best. Please help us through this section so we can know what to do if we have a grievance and quality issue.
Thank you so much, Sandra, and thanks everyone for the robust discussion and questions. It's really important to get those questions out there. You're not the only person who has, that comment or curiosity. So yeah, my name is Frankie. My pronouns are they and them, and I am a Medicaid coordinating attorney with the Urban Justice Center Mental Health Project, and also lead organizer with the Access to Recovery Coalition. But as we mentioned, this is something that we had initiated ourselves and reached out to OMH, and very happy to have them doing this presentation together today. So, despite all this information and having accurate information, as everyone may have experienced, there are, there's often like snags or barriers on the road to getting services. And there's a lot of different types of legal help that's available that's free and confidential. We're going to mention a few places today and kind of discuss like a little bit of like the sorts of help that are available. So help that's available in our office and in several other offices that we'll mention are, so for example, if you come into an issue, let's say you're trying to access your services and you're hitting some roadblocks, you're not sure what to do next, you can do the next steps, whatever they are, but you just need some advice about what is the next step. That's something you can reach out to an advocate around and ask, what are these next steps? If a little bit more support would be helpful, let's say the next steps, you've tried them, you're still not getting anywhere, and you want a little bit of advocacy kind of support, you can also reach out to advocates for investigating what's going on, working with you to resolve complaints and violations of rights. And that's kind of more looking like phone calls to different organizations, maybe like an angry lawyer letter, something like that. And if further assistance is needed, there are also advocates, including myself, who are available to, depending on your specific situation and your geographical location, may be able to represent you and advocate for your rights on your behalf in something called a fair hearing, or in filing different complaints with the state or other agencies. Next slide, please. So this is just, the last slide was kind of a visual slide. This is just sort of repeating what the last slide had said. If you have problems, if you just have questions, you just need an answer to something, there are expert advocates available to help both a person who is directly impacted, or a family member, or a friend, whomever, in resolving issues and accessing supports for mental health and substance use disorder. We can advise you how to file complaints, how to file an appeal. We can investigate something on your behalf, resolve complaints on your behalf, and in some cases may be able to represent you to advocate for what it is that you want. And again, these services are totally free and they are confidential. Next slide, please. So there's a couple of different organizations. I'm just going to mention two today. And again, reminding folks that these slides will be sent out, so no need to kind of scramble and write all this stuff down if you don't want to. So the first organization I'll discuss is the Independent Consumer Advocacy Network. It's a larger network of advocates, specifically around Medicaid HARP. We at the Urban Justice Center Mental Health Project are the statewide specialist, also known as the Ombuds program for Medicaid HARP. So for sort of like these deep dive questions around Medicaid HARP, or even something as fundamental as, do I have HARP? I don't know if I have HARP or not. And that's the case for many people with HARP. I would say probably at least a third of the individuals I've worked with were not aware that they had, in fact, been enrolled in HARP and just didn't even know. So if you have HARP or you want HARP or you just have questions around HARP, you can contact us at 646-923-8397 or HARP@urbanjustice.org. And we'll be sending these slides out just so folks know. Another organization that I would recommend contacting is an organization called CHAMP. It's CHAMP. That's the Community Health Access to Addiction and Mental Health Care Project. They are statewide specialists for all substance use and mental health care. So this is for anyone with any kind of insurance or with no insurance at all. They are kind of like a broader group of folks, so you can also contact them with your questions. And that phone number there is 888-614-5400 or OMBUDS@OASAS, that's OASAS.ny.gov. And these are also sort of no wrongdoer referral pathways, right? So if you call one of us, we can't help you, we'll find somebody who can, right? In most instances, we can find a referral for someone that would be able to provide the legal advocacy advice or representation that you may be seeking. Of course, it's case specific and, it depends on the exact circumstances. Okay, next slide, please. Okay, so what happens when what kind of actions can be taken? Let's say you're trying to access service, you get a denial, something like that. Or maybe you were trying to access a service and you were treated poorly by the person who you were trying to get supports from. So one thing that we can do, either, we can advise you how to do this, we can do this together, or we can do this on your behalf, is to contact the member services of the agency that's giving you trouble, or speak to a member services supervisor. That's always something that you can do yourself, or we're happy to assist. The health plans themselves, you can file a complaint or a grievance with the health plan. They have quality assurance departments that you can file a complaint with. Most providers also will have some type of quality assurance department that file a complaint or grievance with. We can help figure out, who it is that needs to be contacted and how to frame those complaints and grievances so that they're more likely to be heard by the party you're trying to get to hear, or file a complaint, grievance, or fair hearing with the state. Fair hearing is when an administrative law judge decides whether it is you or the party that you have a grievance with who is correct in this decision. Fair hearings do have some deadlines that are important. So if you ever get a letter denying you services or reducing your services or completely eliminating your services, please call, either ICANN or CHAMP or whoever your local legal advocate is right away, because there's some steps required before you can actually file, and there's some rights that you'll want to maintain, make sure to maintain. And I don't want to get into too many details about it, but again, if you have questions or you're a specific incident that's happened to you or that you're trying to solve, you can definitely reach out to us and we'll be happy to talk with you. Next slide, please. Can we go past? We're just going to click to the very end and then we'll take questions because we are at 2:59. So we're going to try to aim to end on time today. If you want to, slides and other resources will be emailed to you. Some useful websites here. You can reach us at the Access to Recovery Coalition through this website here. You can reach the Office of Mental Health, I guess Department of Core, I'm not sure how you all frame that, at this website here. And then I will just pause and let Sandra wrap us up. Any questions that you have, please do put in the chat and we'll make sure to try to get back to you. Oh, Sandra, do we have you?
Okay, I was talking to myself. No, I want to talk with everyone here. Thank you. What I was saying was thank you, Frankie, for that wonderful, wonderful presentation, because sometimes it just gets really, really nerve-wracking. Who do you call? Who do you talk to? Whatever. And so thank you for that. I want to thank everyone that's in our audience. We had, I guess, in our height of about 160 people. And, people were coming in and coming out. I want to thank you for taking your time to coming to our conversational town hall meeting. I want to thank my friends and colleagues at the Office of Mental Health. I want to thank my colleagues and friends at the core services. I want to thank everyone at the Office of Consumer Affairs. And I want to thank my Access to Recovery Coalition colleagues. We all collaborated together and we put this together with the audience and ourselves in mind. And I just want to say thank you. Time is precious. And right now we are at a great point in our lives where we can take control of our health. We can have the necessary supports as was presented here. And please remember that all of this will be shared with you first or second week in February. Everyone who logged in with their email, they'll be sent everything. So thank you, and make sure that you be safe, you be well, and you walk in the faith. Thank you, and good afternoon for everyone. Thank you for coming.
Thank you, Chaplain Sandra.
Thank you, Frankie. Thank you, Sandra. Thank you,
Chris.
Emily, Katie, and everyone. Take care.
Katie, Emily, take care.